Welcome to Health Matters. I'm your host, Kareem Amiri. Healthcare affordability and network availability are top priorities for our employers and members. And key cornerstones to that are managing and improving relationships with our providers. And I have here today Melanie Teske, Vice President of Provider Relations and Engagement, to discuss those topics. Melanie, thank you for joining me today.
Thanks for having me.
Yeah, and since this is your first time on the podcast, if you wouldn't mind telling the audience a little bit about yourself and the role that you have at Wellmark.
Sure. I joined Wellmark about a year ago in this role, leading the provider relations and engagement team. It was a newly defined role. We recognize that providers are a really important part of the healthcare ecosystem. And so we wanted to focus on how do we work with providers? How do we make sure we understand their strategy, what they're challenged with, make sure they understand the perspective of our members and our employers, and do that in a really intentional way. So my team and myself, we have the opportunity to get out. We work with providers, hospital systems, the associations, and we work to build a more sustainable healthcare system.
Yeah, that makes sense. I mean, obviously, everybody understands this. Providers are a key part of the health system. And, from your vantage point, why is Wellmark so heavily invested in provider relations?
Healthcare has become more complex. The financial challenges are more difficult. And so it's really important that we show up and we continue to partner with providers and evolve our engagement strategy in a different way.
What has this work looked like so far for you? How's that gone?
Yeah. So when I started a year ago, we spent some time just really trying to get a lay of the land, understand the state of the current engagement strategy, and then looked for opportunities where we might be able to evolve that. So that encompassed, interviews and conversations with providers in hospital systems, key association stakeholders, as well as many of our internal teams. And where we landed was, as we continue to evolve that provider engagement strategy, we needed to look at opportunities to focus on administrative ease because the systems are complex. And so that can become a kind of a pain point and a barrier for some. We wanted to continue to focus on how we can be more proactive and transparent in our communications. We want to make sure that we are bringing an employer perspective to the provider conversations. That's something that is unique that we can bring to those discussions that they might not always have insight into. And then the third thing was looking at how we evolve the model. So rather than being reactive in our conversations with providers, focusing on more of an account management style model where we are proactive in the discussions, consultative, bringing out actionable information. And so that is something we are continuing to evolve.
So you mentioned you're in the early stages of this. What do you see as the next steps and how does this evolve?
We've done some research. We've done some interviews with different provider systems across Iowa and South Dakota. And we're looking at how do we start fixing some of the more complex systems to make it easier to navigate doing business with Wellmark.
Are you able to share what some of those sticking points are or hard points are for providers?
We require medical records sometimes from providers to ensure that the members are getting evidence-based care. And so part of our policies might require that those records are submitted. And that is just an extra step in the process for providers. And so how they send that information to Wellmark can sometimes be a sticking point. And so we're looking at how do we do that in a more effective way.
Yeah, and I know even when we work with groups and they have members or their employees or their dependents that are going through that, sometimes that'll come up. And yeah, if anything to make that easier, I think will help everybody in the ecosystem.
Yeah, I would say the other thing we really are trying to do as we evolve the model for how we engage with providers is think a little bit more strategically around how do we get them the right kind of clinical and operational performance data to help them manage their business. Okay. So help them see where there might be outliers within their own system around how care is practiced, but also to share some of the kind of more operational metrics that might help them or us identify opportunities to drive more efficiencies between our systems.
So I know there's the difficult part of this, right? Sometimes it gets out there, but why do some provider and health plan disagreements become public?
I don't think it's a surprise to anyone that plans and providers don't always agree on what the level of reimbursement should be. And so sometimes when you can't reach an agreement, those do play out publicly. But what I want employers to take away from this is Wellmark is there to make sure that we are building a sustainable healthcare system and helping to keep healthcare affordable for our members and our employer groups. And so we will continue to do that and have the conversations with providers to try to resolve those agreements.
Thanks for sharing that. And one thing I know for like our national employers is we do a great job here, but how does it look in other parts of the country and our sister Blue plans? If you can give a little insight into that.
What I love about the Blue system is that we really recognize that healthcare is local. So those plans in those states have those relationships with providers that allow them to show up and partner with the providers in a way that makes the most sense for that community and for that state. And so when you bring all of that together, I think that's the strength of the Blues, is that you are not applying a one-size-fits-all model to all providers across the entire country, because healthcare is different and it needs to be addressed locally.
Totally agree. So before we wrap here, what do you think is the key message you want employers to take from this?
When providers and plans work well together, we really have an opportunity to drive better outcomes for members and for patients. And so I would love for employers to take from this that, Wellmark recognizes how critical the provider relationships are and how important it is to continue to manage cost of care for the employers and customers we serve. And so that we are doing this through a really thoughtful and an intentional approach, and trying to do it in a way where we reduce administrative complexity. We are transparent about the challenges that our customers face, and that we are showing up in a very partner-like way with our provider community.
Well, thank you for sharing that key message. And, we were at our time today, and really appreciate you joining us and talking about this topic that really people probably don't really think about, of how that works. And like you said, we've been doing this for a long time, and having a fresh look at it and trying to make things easier for providers, and ultimately that helps our employers and our members.
Thanks for having me.
So thank you for tuning into this episode of Health Matters. We hope today's conversation gave you a better look at how Wellmark is working with providers to make healthcare better. If you enjoyed this episode, please subscribe to Wellmark's YouTube channel, and we hope to see you next time.